Hello, anatomy colleagues. This is Dr. Alsop, and in this video, we will be discussing the arterial supply, specifically of the brain. So we're going to start with recognizing the two major arteries that supply the brain. We'll describe their major branches, as well as we're going to be able to diagram the cerebral, oh my goodness, having a hard time saying it, cerebral arterial circle of Willis. So let's start with these two main artery pairs and talk a bit about where they came from in terms of branching and how they're actually getting to the cranial cavity and brain. So we're going to start with the internal carotid artery. We often see this abbreviated as ICA. Sometimes you even just say ICA. And it's going to be a terminal branch along with its neighbor, the external carotid artery of the common carotid artery. That's that artery that's traveling through the carotid sheath in the neck. Eventually, it makes its way to the base of the brain and will be important in terms of the anterior circulation of the brain. So, most of the cerebrum. The vertebral arteries are the other main arteries that supply the brain, and these arteries will serve the more posterior portions of the brain, such as the brainstem and cerebellum, and also the posterior most portions of the cerebrum. And this is going to be a branch of the subclavian artery that you have there near the clavicle. The internal carotid artery gives off no branches in the neck. That's going to be the external carotid's job. The ICA will enter the cranium via the carotid canal of the temporal bone, and with its branches, again, this is going to be referred to as the anterior circulation of the brain. So let's get into some of the branches of the internal carotid artery, starting with generally the very first branch of the ICA, with the always hard to spell ophthalmic artery. This artery is hugely important in supplying the orbital region and the eye itself. So that's usually the first branch off the internal carotid. Another more distally located branch is going to be the posterior communicating artery. This artery serves as a connector between the ICA and the posterior cerebral artery, which is a branch of the basilar artery formed by the union of the vertebral artery. So in essence, this little artery right here, the posterior communicating, is going to be the main connection between the ICA and the vertebrobasilar system. So it's an important part of the cerebral arterial circle. All right, so moving to the anterior cerebral arteries, these are going to be the smaller terminal branches of the internal carotid, but still very important in terms of supplying, as its name would suggest, the anterior portions of the brain, as well as the medial and lateral portions of the cerebrum. So, right before these two arteries begin to traverse through the longitudinal fissure, you're going to have an extremely small connection between these two arteries called the anterior communicating artery. So that communicating artery will connect the left and the right anterior cerebral arteries. The other terminal branch of the internal carotid, these branches are going to be the larger ones, the middle cerebral arteries. And this is serving the more middle, as its name would suggest, or lateral portions of the cerebrum. It's basically the continuation of the internal carotid. So it just looks like the internal carotid as it moves there, about the same caliber and size. It's often difficult to see the middle cerebral arteries at the base of the brain without retracting the temporal lobe. So a portion of the temporal lobe has been removed in this illustration on the left here to show the middle cerebral. And you can see on the right side of this illustration, you can't see the middle cerebral at all because that temporal lobe is blocking it. The vertebral arteries are a branch of the first part, or the most proximal portion of the subclavian artery, and it will actually traverse the neck via those transverse foramina of the cervical vertebrae C6 through C1. So it's nice and protected all the way up through the neck. And it will enter the cranium actually via the foramen magnum. So it's right there next to the spinal cord and the medulla, just superior to that. It will be in close approximation of the roots of the cranial nerves, specifically 9 and 10 as they exit the brain as well. All right, so there is the largest branches of the vertebral arteries in this region are going to be those posterior, inferior cerebellar arteries. And so you more often hear this artery referred to as pica. And as its name would suggest, it supplies the posterior and inferior portions of the cerebellum specifically. And you always have to take your time in talking about these arteries and make sure you're either talking about the cerebrum or the cerebellum. Those names are very close together, so you always have to be mindful there. All right. As mentioned before, the two vertebral arteries will join around the junction of the medulla oblongata and pons to form the basilar artery. So you can see the vertebral arteries coming together to form the basilar. And that basilar artery, sometimes you hear basilar, that's going to run in close approximation to the pons portion of the brainstem. Now, the reason you hear the term vertebrobasilar system is because the majority of the major branches actually come off of the basilar artery. So not so much the vertebral artery. You'll have some branches in that region, but really the bigger branches are coming off the basilar here. And there's three branches that I want you to be familiar with. The first is the anterior inferior cerebellar arteries, or ICA. All right. This is going to be smaller than its friend pica. It will supply the anterior and inferior portions of the cerebellum, as well as a small portion of the brainstem. There are two sets of arteries towards the more distal portion of the basilar artery. There are the smaller superior cerebellar arteries. This is going to supply the more superior portions of the cerebellum and a little bit of that proximal brainstem. The two terminal branches of the basilar are going to be the posterior cerebral arteries. And this is going to supply the more inferior surfaces or posterior portions of the cerebrum, not the cerebellum. So there's that tricky name thing. So it's not cerebellar, it's cerebral here. These arteries, the posterior cerebral arteries, are going to be connected to the internal carotid by that posterior communicating artery we discussed before. So speaking of communicating arteries, let's return to the concept of the cerebral arterial circle, very commonly referred to as the circle of Willis. And this area of communication or anastomoses between arteries lies at the base of the brain. That image, this illustration right here on the right shows the placement there. And it will serve to connect the internal carotid artery and the vertebrobasilar system. So an important area of anastomosis, providing potential detours for blood flow in case the usual pathway is obstructed by, say, compression, occlusion, or other reasons that can affect blood flow. It's important to note that there can be significant variability regarding what these branches actually look like. So there can be differences in terms of the caliber of the vessels, but also occasionally the branches could be duplicated, or even there could be triples of a certain artery, or a communicating artery could be completely absent. There is variation there. And as you can imagine, sufficient blood flow is so hugely important to this comparatively highly metabolic active brain. And again, the circle is actually formed by these communicating arteries. So that posterior communicating artery is going to connect the ICA and the vertebrobasilar system. So this is the part that's connecting those two sources. And then we do have this itty bitty anterior communicating artery that's going to connect the left and the right anterior cerebral arteries. So those are branches of just the ICA there. It's very, very small, quite difficult to see in dissection, but possible. Now, you will talk about strokes in much, much more detail in upcoming clinical lectures, but I did want to introduce the concept here. So strokes are any kind of rapidly developing focal neurological deficit, so not due to seizure activity. And there are two major types of stroke. There's ischemic as well as hemorrhagic. And ischemic strokes occur with a lack of or just a reduction of blood flow to a region of the brain. And this can be caused by a multitude of factors, such as pathology in the lumen of an artery, with a thrombosis or an embolus, occluding the blood flow to a certain region. Hemorrhagic strokes are most commonly caused by a subarachnoid hemorrhage, so a hemorrhage into the subarachnoid space, typically by a ruptured aneurysm. So an aneurysm is just like a balloon-like swelling of an arterial wall. So if an aneurysm ruptures, this will allow blood to escape into the subarachnoid space because, as we know, most of these arteries are traversing that subarachnoid space. Again, many, many more details to follow regarding strokes, how to identify it, some more specifics in terms of the pathophysiology. But as we were talking arteries, I did want to at least introduce the terms here. Thank you so very much for your time and attention, and please reach out if you have any questions.